Hello, my name is Dr. Sandya Subramaniam. I'm a clinical oncologist with Malaysian Oncological Society. If you're watching this video, you or your loved one may have been diagnosed with cancer. You probably have been given a lot of information which might be overwhelming. This video will talk about cancer therapies and hopefully will give you an overview and an insight on what to expect for your treatment later. Broadly speaking, there are 6 general treatments for cancer: surgery, chemotherapy, radiation therapy, hormone or endocrine therapy, targeted therapy, and immunotherapy. So patients need to be treated for cancer because cancer is basically an overgrowth of abnormal cells in the body, and these abnormal cells, they can take over the organs nearby or can spread to other places and destroy our body. So there are basically in general 2 treatments for cancer, whether it's radical, which means to cure and eradicate all cancer cells in the body, or palliative, which is to mainly prolong your life and to alleviate any symptoms that you might have. So cancer treatment can be also broadly defined into about 5 types. Definitive, which means that it's the only type of treatment that you will get, such as surgery to remove a growth in your leg, for example. It can be adjuvant. Adjuvant therapy means that you've already had a type of treatment, such as surgery, and you have further chemotherapy after that, which is to kill off any other small cancer cells, termed micrometastases, that might still be in your body. So this is usually seen in like breast cancer or colorectal cancer. It can be in the neoadjuvant setting, which means that you haven't had any other definitive surgery or radiotherapy, but you're having chemotherapy to shrink the cells and to make the tumor smaller so that a proper surgery is possible. It can be concurrent, meaning that we give you chemotherapy together with radiotherapy, and this is seen in a lot of head and neck cancers. It can also be palliative, such as radiotherapy or surgery to reduce pain. So before deciding on a treatment for you, your doctor will consider a few factors. Firstly, disease-related factors, which is basically the type and stage of your cancer. Secondly, the doctor would consider patient-related factors, which is basically your age, any other medical illness that you might have, your overall general health, how far away you live from the hospital, your social support, and your personal preferences. There's also treatment-related factors, which would be the availability of the drugs in your center, how effective the treatment would be for you, what kind of side effects you might expect, and also the cost. You may not have to receive every type of treatment. You may receive one, you may receive multiple, and there's no particular set order of the sequences in which you need to receive the therapy. Like for example, I mentioned earlier that you could have surgery followed by adjuvant chemotherapy. You could also have neoadjuvant chemotherapy followed by surgery. So the sequence and the number of treatments you receive depends a lot on the type of cancer you have and how your doctor decides to arrange it. So most cancer treatments do not require hospital admissions. Chemotherapies can usually be given in daycare. Radiotherapy is an outpatient procedure. However, there are certain chemotherapies that need to be administered in the hospital. For example, infusions that last over a few days. Most cancer treatments are not painful. However, you might experience a bit of unease, especially when they are setting a needle into your arm or into your chemo pot. The other thing that might be painful would be certain side effects from certain therapies. Like some chemotherapies can cause you to have dry mouth, ulcers, or even gastritis. There are multiple treatments available to reduce these side effects or even prevent them altogether. So you should speak to your doctor about that.